Hi, this is Steve Israel. Welcome to my website. Forgive the sound of my voice. I'm battling a pretty ferocious cold, which is exactly why I want to talk to you about health care. You know, there's been a lot of talk about the uninsured in America, but lost in that debate is what the present status of health care means for you, whether you're insured or not, how it's affecting your pocketbook, how it's affecting your health. We're paying $2 trillion a year for American health care. That's premiums, it's insurance, it's your out-of-pocket expenses, it's the tax obligation towards health care. We're paying double what most of the rest of the world pays for health care, and yet we're falling further and further behind the rest of the world in how we're treated. In fact, in terms of life expectancy, we are 45th in the world. We're behind Bosnia in life expectancy. Bosnia doesn't pay what we do, and yet Bosnians live longer than we do. In terms of infant mortality, we are 28th in the world, just behind Cuba. Cubans don't pay what you do for health care, yet Cuban infant mortality is better than it is in the United States. Today, the leading cause of bankruptcy is not a failed business, but unpaid medical bills. People just lose their insurance, they can't pay for their medical care, and they go bankrupt. Meanwhile, insurance companies posted $30 billion in profits last year. So insurance companies are getting richer, our economy is getting poorer, you're paying more and more, and you're getting less and less value. That's why we need to fix healthcare in America. Now, we're going to be debating over the next several weeks and perhaps months healthcare reform. And I know that it's going to be controversial. And I know that you have some very deep concerns about what it's going to look like, about how it's going to affect you. It's very important to me that I understand your opinions and that I have the benefit of your views. So I'm asking you to fill out a survey that's on this website. I'm asking you to contact my office and let me know what your priorities are in terms of health care. Let me know what you think that we should be doing to make sure that we are not paying more for less. I can't imagine that you would walk into any store and pay more for a broken product. The fact of the matter is that that is exactly what we're doing in healthcare in America today. So whether you're insured or not, whether you believe that your specific plan is the best or not, I think we can all agree that when we're paying $2 trillion in our economy and not investing that in more productive activities, and we actually are behind Bosnia and Cuba, that we've got something that needs to be fixed. And I look forward to working on that fix with you in a reasonable way. Thanks very much and stay in touch.